Hi there, it's Dr. Mary Barbera, and I am excited to tell you about some things that I just learned about autism research in the recent few days. I am going to talk about the Huberman Lab and a special interview that Dr. Andrew Huberman did with Dr. Karen Parker and why that's important. And then as we get into summarizing some of the highlights, we're also going to discuss this paper where Dr. Karen Parker is the first author on intranasal vasopressin. I promise I'll make it as simple as possible. And it was a lot of things I learned, so I wanted to get that to you. So let's get to it. Okay, welcome back to those that have been listening or watching a long time. We've been at this for 5 years, and weekly shows. And I am a registered nurse, a behavior analyst. I have a PhD in leadership, and I am providing online courses, 2 books, and weekly podcasts and lots of videos, daily videos, to help both parents and professionals turn autism or signs of autism around through all positive methods. We teach and go over things to increase talking, decrease tantrums, improve picky eating, potty training, and so much more. So today is a little different. I had heard about the Huberman Lab recently and wanted to tell you a little bit about that and this really great interview. The first interview, I think, about autism. And so the Huberman Lab has a website, hubermanlab.com, but they also have a YouTube channel with almost, by the time this airs, will be 5 million subscribers. So it's huge and it's pretty scientific, although Dr. Andrew Huberman runs it. He's the host. He's a neuroscientist and professor at the Stanford School of Medicine. And he interviewed in December of 2023 Dr. Karen Parker and all about the causes and treatments for autism. Now, Dr. Karen Parker is the professor of psychiatry and director of the Social Neurosciences Research Program at Stanford University School of Medicine. So they are both PhDs and both from Stanford, and they are very knowledgeable about autism research. So the whole interview is just about 3 hours long, and I listened to a good majority of it, and I am going to summarize the overall interview. For those of you that want to watch the whole thing, I really strongly advise, and we will put it in the show notes below, how you can get to the Huberman Lab in December for that interview with Dr. Karen Parker. But I know many of you probably just want the highlights. Some of the initial things they covered were things that you probably know, but as we dive into this intranasal vasopressin, I'm sure there's most of you that are not going to know about that. And it's important whether you have a very young child with signs of autism or even an older child or clients, or maybe you're an autism researcher yourself. This is kind of an unusual topic, although a few months back, I did also review this article on the persistence of autism spectrum disorder from early childhood through school age, with the first author being Dr. Elizabeth Harstad. So we might make this more of a thing where I dive into a research study and share what I learned. So one thing I will say is I really liked Dr. Andrew Huberman and Dr. Karen Parker. They both were very, said parents of kids with autism are heroes. They are funded. Dr. Karen Parker and her lab is funded a lot through the Simons Foundation Autism Research, which funds $100 million a year for autism research. And then there's Spark, which came after Simons Foundation, but Spark is the Simons Foundation for Powering Autism Research and for Knowledge. Spark started in 2016 and is a program of the Simons Foundation that aims to build and retain a cohort of 50,000 families with autism. And it's the largest autism cohort in the world to advance research on the genetic, behavioral, and clinical features associated with the condition. Our family joined Spark, and this, of course, is at no cost. And we joined in 2018 when I first found out about Spark. And we have enrolled in several studies. The first study being collecting saliva. We've never gotten blood tests or anything like that. We've mostly done surveys. We've never traveled for any studies, but it's a very good thing to do. I would encourage families to at least look into joining Spark for you and your family, because all of that data from the 50,000 families can be pulled together so that autism researchers like Dr. Karen Parker and her colleagues can really make some progress. Also, in terms of Spark, I interviewed for my podcast years ago, Dr. Pamela Feliciano, and we can link that in the show notes as well. And our family was also featured on the Spark website a few years ago too, and we can link both of those. So let's just talk very briefly, like in the next 10 minutes, and I'm just going to cover the basics of what the interview, the 3-hour interview, covered in the beginning, just some general stats. You may or may not know these. Right now, 1 in 36 US children have autism, and for every girl who's diagnosed, 3 to 4 boys are diagnosed. And both Huberman and Parker agree that it is definitely better detection and screening, but there is also a rise in prevalence. The diagnosis is based on symptoms. So there is still no blood test or scan to rule in or out of autism. There have been, for as long as I've been in the autism field, over 2 decades, there have been centers and hospitals, children's hospitals, like in my area, Children's Hospital Philadelphia. There's also one at Kenny Grieger, I believe, or there was one. There are siblings study centers. So if you were pregnant, you already had a child with autism and you were pregnant or had an infant, there is an opportunity for you to participate in studies with your newborn or infant or toddler. I'm not sure how long you have to enroll them, but it can really help because siblings of kids with autism are at much higher risk for developing autism themselves. I believe the latest studies I've seen have been like 19, 20%. So like 1 in 5 children of a sibling will go on to be diagnosed. But I do know people that have participated in the baby sibling studies, and it's good for you too, because your child, if enrolled, they will keep a special eye on. If they are showing signs, you can get an early diagnosis quickly. You can get behavioral therapy quickly. So as we know, autism is a disorder that includes social language delays and repetitive and restricted interest, but the spectrum is huge, going from very severe to very mild, and there's probably more than one spectrum, according to Dr. Parker. The research using mice models and rodents don't really translate well into humans because of that social language component. And so non-human primate preclinical models, especially monkeys, are really the closest to watch in terms of social abilities, but there's other mammals that also have been used. Hey there, it's Mary, and I'm just breaking in to let you know about a special offer we have just created. So it is a 5 days to more talking, do-it-yourself mini course. You can start it today and get through the content and really see hopefully a dramatic increase in language. We have a special rate right now, 50% off. And if you use the coupon code podcast when you're checking out, you'll get an extra $10 off. This is for a limited time, so get all the details at marybarbera.com/5days. And don't forget the coupon code podcast. Now let's get back to the episode. Variables that have shown an increase of autism in previous studies over the decades have been advanced parental age, severe prematurity, maternal illness during pregnancies. And Dr. Parker also said that there definitely is some genes and environment that sets people up. Environmental influences are very important, as is the genetic makeup. But it is difficult to do autism research because there are so many variations. Like a child or an adult could be, considered higher language but lower social, or higher social but more having behavioral problems. There's also a lot of comorbid conditions, including intellectual disability, ADHD. There's some people that have autistic-like traits, and they do have a genetic condition that can be pinpointed, such as Fragile X. So that's kind of the general gist of what they talked about in the first hour or so of the 3-hour interview. Then they dove in pretty seriously to neurotransmitters, which are occur in the hypothalamus part of the brain, and these two are vasopressin and oxytocin. They're both similar in terms of they both impact social interactions in humans. Vasopressin also has control over blood pressure and urine output, and oxytocin, many in the medical fields will realize that like oxytocin, it has a big component in birth and in milk letdown when you're breastfeeding. So Dr. Parker has done a fair amount of research in oxytocin, delivering it intranasally, so through nose spray, oxytocin. And in some of the smaller studies that Dr. Parker did, it really did correlate well with increase in social abilities. But it was never approved. In fact, she mentioned, which might be familiar to you, is that there are only 2 meds approved for autism spectrum disorder, and they are both antipsychotics. One is Abilify, and the other one is Risperidol. Those are the trade names for those medicines. So everything else that doctors use, that families have their children with autism on, are used off-label or to treat another comorbid condition. So I did a podcast interview with Dr. Michael Murray, who's a psychiatrist, and we talked about, that's something good that I can also link in the show notes below. But Dr. Murray put Lucas on a cardiac med because of what he diagnosed was an autonomic nervous system dysfunction, in addition to his autism. So he was getting problem behaviors related to being startled or in pain. And this beta blocker, this cardiac medicine, has been a real godsend to Lucas. So that's an example where that is being treated off-label. There, at the time when it was that autonomic nervous system dysfunction was diagnosed and started to be treated, it was a decade ago. At the time, a decade ago, there were only white papers on this use. I mean, beta blockers are well studied in adult populations and cardiac populations, but they're not well studied in terms of double-blind, placebo-controlled studies in autism. So, so while Dr. Parker and her colleagues found that oxytocin had some promise, there were only a handful of very small studies at Stanford and maybe other places, but they were using mice, and they were then using nasal spray for oxytocin. But the problem is that then with those smaller studies, then it goes to the next level of funding, which is phase 3. And in phase 3, the oxytocin given intranasally provided no benefit to the larger population. And so it was a negative trial. And so oxytocin as a treatment and as a research promise kind of lost a lot of its steam. It did in the smaller studies show promise, like I said, and it was shown to be safe from this smaller study as well. So that gets me to vasopressin. And vasopressin, like I said, is very close to oxytocin. And this article was published in 2019. The study was done before that, and it's there's probably 12 or 15 authors on here, and the first author is Dr. Karen Parker. So she did, in this 3-hour interview, discuss this article a bit. But I actually printed it out, got it. There's show notes in below that 3-hour interview are amazing. There's tons of studies there. So if you are interested in autism research, I would really encourage you to listen to the whole 3-hour lecture, but also to check out all the show notes and all the papers in there, which are really great. So just to give you a little what the actual studies showed, this was 30 children, 25 males, 4 females. Vasopressin showed a lot of preclinical success in trials with other mammals, non-humans, and it improved social behavior with the vasopressin. So they recruited children in the study. There were 30 children, and they were 6 to 12.9 years of age. They had to have a clinical diagnosis of autism. They had to have IQs above 50. And there was a couple other criteria, but they got baseline labs, blood draws, and they tested the vasopressin. And they were they used the social responsiveness scale. So they were looking for what their levels were based on, and then their baseline scores on social responsiveness. They also tested anxiety, and yeah, so it was really interesting. The other thing they said in the interview, which is also in the paper, I mean, this paper is several pages long, 12 pages long, and it's pretty technical. They said that really the other reason that vasopressin has a lot of promise is because they got samples of cerebral spinal fluid, and that's the fluid that goes around your spinal cord and up through your brain. And there's vasopressin levels in there. Obviously, that would require a spinal tap, which is much more invasive than a blood draw. But they found that kids with autism had very low levels of vasopressin in the cerebral spinal fluid, and that the lower the level in the spinal fluid of vasopressin, the more severe the autism was. And that was pretty good correlation across the board from their samples. This is previous to this study. So they were pretty, they were going with just blood draws, pre and post, and then 4 weeks of intranasal vasopressin, and it did show promise with these 30 kids. The experimental group went up in social responsiveness, went down in anxiety, and they also found that the baseline scores being low but higher than the other kids actually showed better response too. A couple of things as a researcher that was good to see is, when you do this randomized double-blind placebo effect, that means that the researchers don't know who's getting the actual real medicine and who's getting the placebo. The parents don't know, the kids don't know. And they said with this study, they were extremely careful about not trying to, not disclose that. So 2 things of the study that I thought was unique for the study was, one of them was they asked the parents, I guess during or after the 4 weeks, do you think your child had the medicine or was in the placebo group? And there was no correlation. So they did a good job of controlling that. And then they also weighed the nasal spray at the end of the study to check for compliance. And there was no difference in the compliance between the placebo and the other group. It was safe. No one dropped out. No vital signs changed. No weight gain. And just overall, everything, tolerated well. And they are, during the interview, they talked about how they had a bigger trial either in progress or were planning for that. And so I really enjoyed listening to the lecture and that, or the interview, and then also reading. They did say being an autism researcher is a tough field. But my hat goes off to all the autism researchers out there who are really trying to do their best. But really interesting. And they even said, since so much is being used off label, it might be, wise or prudent to push this research along, but also for people to just be aware of even oxytocin. Dr. Parker was saying how the hard part about oxytocin is as soon as you draw it out, it kind of collapses, like it needs to be in super cold conditions. And if things fall apart, it could definitely affect the study. So she still seems to think that oxytocin has promise, but now it seems like vasopressin is the real thing that is showing tremendous progress. So I hope you enjoyed that little summary. I really would encourage you to check the links right below this video, to go on hubermanlab.com, to go on their YouTube channel, to download these articles that are right below the December 11th, 2023 interview. So that's all I have for you today. I learned a ton about some of the intricacies of studying, intranasal oxytocin and vasopressin. And it's good to know that the Simons Foundation continues to provide $100 million of research. I really would encourage everybody to look at joining Spark if you're not already a member, and really get behind these researchers to try to find treatments that work for a wide variety of kids. So I will see you right here next time, same place. Have a good one.